Are you aware that sickle cell disease, SCD, is the most common inherited blood condition globally? In fact, Nigeria is arguably the most sickle cell endemic country in sub-Saharan Africa. Welcome to the light. Thanks for joining me on this edition of The Light. The Light is a dynamic, sustainable development-focused radio TV program, bridging the gap between Nigerian professionals abroad and those back home for sustainable national development. I am Ife Aronwo-Kafo. And on this edition of the program, Nigerian-born Dr. Stephanie Obunda joins me from the United States of America to share her latest research findings on sickle cell disease and much more. Dr. Obunda, it's good to have you here.
Thank you so much for having me. How are you doing today?
I'm very well, thank you. You look great.
Thank you. My name is Stephanie Obonda. I'm originally from Nigeria, where I spent my primary school education before I proceeded to Ukraine and then United States, where I'm currently practicing as an internal medicine resident. So it is very important actually to bring home ideas. And the reason for this is it brings me actually back to why I wanted to study medicine, especially outside of the countries, because there's so many new innovations that we see here every day that bringing these ideas back home will definitely help ease the burden of morbidities and mortality that we face, especially back home in Nigeria. There's so many things that's like new down here. There's so many tests, there's so many trials that keep on going on that we can benefit from and send back home. So I think it's very important.
Okay, and at the point where you traveled to the United States of America, what was in your mind? Because when I thought about this interview, I was looking at some of the themes that we would explore, especially since you're talking about sickle cell research. What drew you to that aspect, given that this is something that our country is in dire need of?
Yeah, for sure. So sickle cell disease, I think every or most Nigerians, if you mention sickle cell, they know what you're talking about. But the details about this disease, I'm pretty sure, is very vague to many people. So for a disease that affects so many Nigerians, I think it is important to understand, why we have this disease so rampant. What are the symptoms that we experience? What is your prognosis as a sickle cell patient or a carrier? And is there any treatment? Is there any cure? Is there a way for this to be gone permanently? I personally have friends who are, sick, who have sickle cell disease, and I see them in pain. I see them suffering, and it really, hits close to home. And that's one of the reasons why I went into this research. Another reason I would say is here in the United States, for example, we see a lot of foreigners, a lot of people traveling from different countries, people of the African descent, the Jamaican, the Caribbeans, and these people all come together to form this melting pot. And we noticed actually, the doctors and I who came together to work on this research, that when a patient comes to the hospital, it almost like depends on where they're from. Their symptoms or the things they present is somewhat different. And so I think that's why we went into it, because we understand that this disease is very prominent in Nigeria. We see a lot of people coming with most especially pain, but then we see patients here coming with different other side effects that are even more dangerous. So we decided to explore it and see how does this affect us as a country, Nigeria, and what ways can we actually bring back information to help reduce the prevalence of the sickle cell disease back home.
A certain person I know who has sickle cell disease, it has affected her education a lot. Most times she has to be home or in hospital. I even lost a classmate to sickle cell disease. She was my classmate in secondary school. So this particular lady that I'm talking about, we're told, I don't know if it's a rumor or does that really happen, that their blood is drained, or and then they have to keep transfusing blood. So it's like refilling her blood each time. So they spend a lot of money. These people who are already affected, these families who have to bear this huge burden, is it possible for them to access fund to be able to continue to do this? And does it happen all lifelong?
I know there are lots of hematologists in Nigeria. So find yourself a hematologist, find yourself a primary doctor, and follow them very frequently. These things, prevention is always better than cure. You're spending lots of money on treatment when you can just spend even less on prevention. So hydrate, stress free, make sure you rest, make sure you follow your doctor very closely, and always find out about these therapies. And then you mentioned something about funding. Knowing that Nigeria is one of the hotspots for sickle cell disease, that's something that, as a healthcare professional, if you're in Nigeria, I think you should explore. I think um, you should write out, seek grants, because if you come up with an idea that you can collaborate with physicians, maybe here in the U.S. or in other countries in Europe, I think you should be able to get grants even from the national board, to see how you can promote these therapies that have decreased the morbidity of sickle cell. I think you should be able to do that. So I think that's something worth exploring. Explore these ideas and see how you can get grants to help fund research, or to fund sending out trials gene therapies to Nigeria.
Um, Doc, you've just said something very important, because I didn't even think it was possible to get funding for to manage sickle cell patients in Nigeria. So, can you walk us through certain things that our doctors, our specialists who already have maybe their friends, colleagues there, someone like, okay, Dr. Stephanie Obunda is in the US. So, a doctor here who is listening now would want to understand the step by step process towards getting such grants to help their patients back home. So can you walk us through what can be done in that regard, and certain places they can look, what they can check out on the internet?
Sure. So, what we did here, for example, to get our research going, was we looked at the national statistics. We looked at we have a database. We looked at it to see how many people are hospitalized for sickle cell within a year period, or like a 5 year period. So I think that's something that you can maybe start with. Just look through the country and find out how many times, or how many patients have been hospitalized with sickle cell. I think that every country has a database that where they store this information about diseases in the country, deaths in the country, births, things like that. So look into it. Look into how many people are diagnosed with sickle cell. I know that it would not be 100% accurate. It's never 100% accurate, because not everybody registers, or not everyone who actually is having a crisis goes to the hospital. But I think that's where you can get the meat of information. If you come up with something like that, how many people have been hospitalized for sickle cell in the last year? How much does it cost for one visit in the hospital? You can calculate how much it costs, how much does it, do you pay for the drugs that you need for pain, for IV infusion, things like that? How much is a typical hospital stay in Nigeria? You can come up with a math around a rough figure of what it'll take every time a patient has a crisis and they need to be in the hospital for 1 day to 1 week. How much are they costing the economy? If you can come up with that kind of figure and see that maybe collaborating with an organization, maybe here in the US, for example, to bring over therapies that can reduce this hospitalization will save X amount of money. It's all about saving money. One, it's all about preventing these hospitalizations too, right? So if I tell you that if you provide us with this amount of money, and we can bring over these drugs and spread it as far and wide as we can throughout the nation, then we're going to save the government maybe 5 billion naira. That's a good way to look at it. Not only are you saving money, you're also improving the health of so many people who would benefit from these drugs, who would benefit from these care. Another thing one can do is you can get most of these information from specialist clinics. I know there are specialist clinics that are just the only thing they do is specialize in patients who have sickle cell disease. They have lots of information there. So go talk to them, go collaborate with physicians there, find out where are you guys now in terms of advancement of therapy? What therapies do you provide for your patients? Things like that. You can start that way and let the information that you find guide you.
Doc, where can they find these people, the specialists? Simply Google or to come to the US and look around. If you were in Nigeria now and passionate about treating sickle cell patients, where would you look? What would you actually do?
Let's say Port Harcourt or Abuja. I would Google what clinics exist. Do we have a hematology clinic, for example? If we have a hematology clinic, I would go there in person and find out, okay, what's the bulk of patients you see here with sickle cell disease? I'm working on this project. I'm very passionate about reducing the morbidity and mortality in sickle cell disease, and I want to collaborate with you. How many patients? If most of the time, if there's a hematology clinic, the most of their patients would be patients with blood disorders, including sickle cell disease. So I would start that way. That's one way. Another way is if you look on Google, we have databases, both here in the US and in Nigeria. It is required. You can look at the WHO. WHO usually has information about the prevalence of diseases in different parts of the world, different countries, different nations. So just if you look into that, you would find information that would guide and of course the information you find would make you ask other questions like, okay, is there a way to maybe reduce this, or is there a way to make this better? And then with the questions you ask, you identify more sources that can guide you to providing this information.
This is The Light, our dynamic, sustainable development focused radio TV program. For questions, reactions, suggestions, contributions, participation, partnership, and sponsorship, message us on the WhatsApp number 0816 720 1207. Again, 0816 720 1207. Do send an email to the Light TV Show 01@gmail.com. You can also like and follow at Ifi Aronwokafo on Facebook, Instagram, X, and TikTok for regular updates. The Light is back. Thank you so much for staying tuned. We still have Dr. Stephanie Obonda, a Nigerian-born US-based medical practitioner, right here. Now, Doctor, what aspects of your research findings do you believe can benefit the Nigerian healthcare system, and in what ways?
I think the way my study can contribute to the healthcare system of Nigeria is firstly by helping us understand that this disease is still very much prevalent, and we still have quite a number of people who are still struggling with symptoms of pain and other more deleterious symptoms from this disease. It is still a growing field. There's still room to improve on curative methods. I know now there's gene therapy, which is unfortunately not very much accessible to a lot of people, but that's something that we can explore as a country to see what kind of treatments we can bring to our people to help alleviate not just the symptoms, but basically find a way to promote the cure for sickle cell disease so that they do not experience the symptoms at all.
I believe that most of our listeners are wondering about this, and I need to ask this question. Is it even possible to achieve a sickle cell-free world? And how soon?
Yes, I strongly believe it is possible to achieve a sickle cell-free world. Would I be alive by the time that happens? I doubt it. But what I'm trying to say is it will take a long time before we can make this kind of therapy accessible to every single person with sickle cell. But I believe it's just a matter of time before this treatments are accessible to everyone who currently has sickle cell disease. Right now, there are two FDA-approved gene therapy that have been found to be curative for sickle cell disease. However, like I alluded to previously, these therapies are obviously not very accessible to a lot of people, partly because it is very expensive, as you can imagine, and also there are still a lot of people who obviously would be very skeptical about receiving these therapies. So as we continue to develop more ways, I mean, the truth is, once there is one way that has been found, that gives us hope that there could be other ways that can be developed. So once we continue to explore these gene therapies and try to make them accessible to as many people as possible, and continue to expand on our raising awareness so that we do not increase the incidences while we're trying to decrease the prevalence, we can get to a point where we live in a sickle cell free world.
Now, let's talk about the low-hanging fruits. Are there more effective interim measures for the prevention, curtailment, diagnosis, and management of sickle cell disease in Nigeria?
I think some of the ways that we can approach the diagnosis and management of sickle cell disease is firstly by identifying patients or people who would be at risk for developing sickle cell disease. This is why we continue to emphasize the need to know your genotype, because if parents know that they're sickle cell trait or sickle cell carriers, then we can test their newborns for the sickle cell disease and begin to act from the back end. By checking their genotype at birth, we would know if they have sickle cell disease or even the trait. And some of the ways we can manage sickle cell disease is, firstly, we can go from the angle of prevention, preventing crisis, preventing these complications that can arise from sickle cell disease, continue to encourage our patients to live as stress-free as possible, to avoid overexerting themselves, to continue to hydrate, especially on really hot days, to try to make sure that their lives are, they stay away from infections, they receive the vaccinations that are prescribed to them by their physicians. Ways like that can prevent or at least reduce the amount of times they need to be hospitalized for different kinds of crisis or complications of sickle cell disease. And then based on the severity of their sickle cell disease, we can talk about medications such as hydroxyurea. And what that medication does is it increases the amount of the fetal hemoglobin, which these hemoglobins do not sickle just as much as they don't sickle as the original HbS, which most of the patients have. So increasing the amount or the ratio of that would ensure that they have less crisis. So I guess these are some of the ways that we can manage patients with sickle cell disease. And for those who are able to afford it at this point, we can talk about exploring some of those gene therapies that we talked about, or exploring other therapies that could be helpful in even providing a cure for them.
We are well aware of the present gaps in the Nigerian health system, but in what ways can sickle cell patients and families who are prone to the condition begin to take more responsibility towards reducing mortality rate?
Some of the ways that they can take more responsibility, I would say, would include just ensuring that their children or they themselves have regular checkups if they have sickle cell disease, making sure that they stay hydrated, making sure that they, especially in days that are very hot, just continue to hydrate, stay away from the sun, because that tends to dehydrate, and then they're more prone to sickling and development of complications of sickle cell disease. Having frequent checkups, talking to their doctor about their options, even before they have any symptoms. Just finding out ways they can, or medications they can take. Like I mentioned earlier, the hydroxyurea. I know not everyone qualifies for it back home, especially because it might be very expensive. But just talking to their doctors about who, if their children or if they themselves would benefit from that therapy, given the amount of hospitalizations they've undergone or the amount of symptoms that they experience in a year, because that would increase their fetal hemoglobin, and that would decrease the sickling hemoglobin. And also talking to their doctors about the recommended vaccines that they need to take, because as we know, one of the main causes of death in patients with sickle cell disease is infection, sepsis, acute chest syndrome, things like that. So if they can take these vaccines and prevent these common infections that are common to sickle cell patients, then they can reduce their mortality from sickle cell disease. Overall, we're hoping to get to a point in the world where we can say the world is sickle cell free. But until that time, we can do what we can to prevent these exacerbations or these frequent infections or frequent pain crisis. And also, I would say from the healthcare provider perspective, we can try to raise awareness, especially in areas where they don't even realize that there are things they can do to reduce their symptoms. We can go to those areas and raise this awareness and let them know that they can, have a physician see them frequently. They can try to take those vaccinations as well, and also try to prevent their further generations from developing sickle cell disease by not procreating two people who have the sickle cell traits. So ways like that, and we're looking at improving our numbers in the future and decreasing the symptoms, decreasing the overall mortality, and decreasing the amount of people who have the sickle cell disease. So final thoughts. First of all, thank you so much for having me, Ify. This was a good opportunity to actually express one of my passions, which is sickle cell disease. I believe that this is 2024, and I love my country so much. I love Nigeria so much, and to see the amount of people that are still suffering from sickle cell disease is really heartbreaking, especially given the amount of research that has gone into sickle cell, especially given the amount of advancements that have gone into sickle cell. This should actually stare some other people. If you're listening to me and you're a healthcare provider, please look into this. We should not keep suffering. We should not keep having people in so much pain or having early deaths because of sickle cell disease. It's not we have so many advancements that we can tap into. You can come up with a good proposal, and if you want to work with me, we can do something like that. Come up with a proposal, find ways to actually reduce this morbidity and mortality. I think it's high time. It's 2024, and this amongst other diseases, but particularly sickle cell, because it's very prevalent in Nigeria. So I would say, if you are practicing in Nigeria and you have patients in this way, pay close attention to them. Don't just treat them symptomatically and get their pain controlled and send them out, but pay close attention, because I think their entire lifespan, the way they live their lives, their functionality, depend on you actually looking into providing them the best therapy possible. And I would also say that if you have sickle cell disease, or you know someone, one of your loved ones have sickle cell disease, tell them to pay attention to their health. Tell them to act preemptively. They shouldn't wait till they have symptoms before they go to the hospital. They should be followed by a doctor closely. You should have a primary doctor. You should have a specialist doctor, a hematologist. Even if you're fine, even if you think, oh, I don't have that much crisis, have somebody you follow. That way they can check you constantly. They check you at least once a year. If they check you that way, they can catch things before they happen. You don't want to get to a point where you have a stroke before you are now trying to find a doctor. So find a doctor, make sure you're being followed by a primary doctor, your hematologist. Make sure you're living a stress-free life. I know it's difficult to say anywhere in the world it's stress-free, but pay attention to your body. if you notice that you're coming down with even something as small as a cold, take it very, very. I'm hoping to collaborate with other healthcare providers who are interested to do more research into this topic and into finding ways to actually reduce mortality and also morbidity, and ways that we can pass this information to those who do not have a means to access valuable information that could be saving their lives or their children's lives.
Dr. Stephanie Obunda, thank you so much for providing clarity. We wish you well. And that's it on this edition of The Light, the first ever radio TV program, tapping into the knowledge base of Nigerians in the diaspora and within the country for sustainable national development. Right here, we bring our best brains home. Anticipate the next edition of The Light. Same time, same station. I am Ife Aronwo Kafo. Wherever, whenever, be the light. Goodbye.